Healthcare for All has a new report on the importance of early response to mental health needs and the barriers to recovery. As the report explains, the barriers range from social attitudes to the cost of care and the complexities of insurance. To tell us about the problem and some possible solutions is our guest from Healthcare for All, the Mental Health Parity Project and Research Coordinator, Natalie Litton. Thank you very much for being with us, Natalie.
Thank you.
Natalie, one of the first things you also did in this report was you talked to the people who are living with this problem. What was that like for you?
Well, it was very interesting, and I think we had in mind throughout the project, and I think as the project progressed, we became even more convinced that it was important to have real voices in the report. And we spent a great deal of time working with the National Alliance on Mental Illness of Massachusetts, and they have a resource helpline, which is called Compass, and they receive over 2,000 calls a year from individuals and family members seeking information, sometimes information about what is going on with their loved one or their friend, and some more specific about what services are available, how to navigate insurance, what are the programs out there, education. And we culled through call logs from NAMI Compass, and we found themes that lined up with the other research themes that we had found, and we sprinkled that research, those call logs, in redacted form throughout the report. And we hope that that helps to bring the real live voices of individuals and families who are struggling every day into the report.
Well, in that real world, you could have a child who has disruptive behavior, and you get a parent thinking, oh, somebody's going to blame that on the parent.
Absolutely.
And they just don't call it mental illness. I mean, how do you break through that?
Exactly. We found and heard again and again in our research reticence on the part of family members and parents particularly to get children help, because so often in schools, disruptive behavior, misbehavior is labeled as bad behavior. And it's not recognized that these are symptoms of an illness, which are often treatable, and that care, mental health care, not punishment, is the answer. And I think that goes back to a larger issue of stigma, of prejudice, of negative stereotypes that follow people with mental health symptoms and mental illness throughout their lives. And that is something we examine in the report.
Well, when these things happen with children, we also trivialize it, but if you don't deal with it early, what's the cost down the line?
Well, as we say in the report, homelessness, incarceration, substance use are three very well documented, devastating consequences of failures at the front end of the mental health system. And that can be early in the lifespan, children. That can also be early after the onset of symptoms later in life. And so we came to the really strong belief throughout this report that it is essential to engage individuals and families early on to avoid those consequences.
How do you connect with them? I mean, I imagine a lot of these families have at least basic health insurance. Maybe they see primary care physicians every so often. So how do you go from there to making sure that they know what they can do about a mental health problem?
Well, knowledge is a huge barrier to treatment, care, and recovery that we talk about in the report. People simply don't know often what mental illness looks like, don't know where to go for information. And in our Search for Solutions section of the report, we explore a number of programs that are already in existence across the Commonwealth that are helping to engage families, to engage individuals early on. And we believe that by expanding, by funding, by increasing information about these programs, as well as looking out for public policy opportunities to strengthen such programs and such practices, we really do have the ingredients for a better system.
This is BNN News, and we're talking with Natalie Litton from Healthcare for All. Natalie, if someone is trying to treat a mental health problem, you see a primary care physician, maybe once a year, that's $20, no big deal. Then you have to go see a therapist who's going to specialize in the mental health issue. It's $20 per visit, but you might have a lot of visits. So, I mean, how do people pay for that?
Exactly, Chris. There is I think people think that since there are mental health parity laws, that takes care of the price issue. That's not true. We heard over and over again the refrain, it all adds up. So if I have a $20 copay to go to my primary care physician, and I also have a $20 copay to go to outpatient mental health treatment, that seems on par, that seems equal, $20, $20. But as you said, you go to the PCP once a year. You may have to go to an outpatient mental health provider once a week. That $20 adds up very, very quickly. And so we found that the parity laws in so many ways don't take into account the differences between medical surgical care and mental health care. And so that's an area where there is much work to be done.
What about just the complexities of insurance, navigating it? Talk about that and what maybe should be done.
Well, there are often legislation opportunities where insurance practices, insurance complexities can be simplified. There is something, often the first thing that an individual or family will do is call the insurance company for the name of a provider. And individuals and families are given long lists, provider directories, and they may have hundreds of providers on them. But it is often the case that these lists are not up to date, these lists are inaccurate. They list providers that are no longer taking that insurance, or have moved, or even are deceased, which is why they're sometimes called ghost panels. And Healthcare for All is supporting legislation that would mandate that insurance companies update and make more user-friendly these provider directories.
I know you recommend some more use of peer support.
Yes.
But also interesting, what about some of the programs going on that shows that there's a more effective way to deal with the problem and they're getting good results? Is there anything that you could point to?
Programs that are
getting better results with recovery, at least,
yes.
or treatment?
Well, I think of two examples which are statewide, which are the emergency services programs and the Children's Behavioral Health Initiative. Emergency services, you can call your local provider and they can come to you. They can de-escalate the situation. It's often a alternative to going to the emergency room, which has all sorts of other issues, or of entering into the criminal justice system by calling the police. And emergency service programs are available largely only to those who have mass health. So the 70% of Massachusetts residents, with some exceptions of insurance companies that contract with ESPs, are not able to access the services of ESPs. There's legislation currently pending that would mandate commercial insurance coverage of ESPs, which would expand a program that is seen as very effective to diverting people from the emergency room and from the criminal justice system.
I have just a little time, but one of the things we didn't know, there is an overlap here with people struggling with substance use too,
Absolutely.
Right? Thank you very much. We should finally mention, you've got this report online, so where should people check it out?
Yes, if you go to the Healthcare for All website, hcfama.org, you can see the report as well as our appendix and our methodology.
Thank you very much for being with us.
Thank you.
Natalie Litton from Healthcare for All.